some patients have asked about a specific blood test, and in all fairness, some clinicians do use it, and that's CA19-9. We touched on it earlier, but they seem to think that's a screening test or a test that will determine the presence of pancreatic cancer. Why is there that common misconception, and how can we stop that?
Well, first of all, CA19-9, it's a tumor marker.
Correct.
For if you have pancreatic cancer. So it's actually not a screening tool. It has never been meant to be used as a screening tool. It has been meant to use as a surveillance tool. So a patient who has pancreatic cancer and is on treatment, whether it have been surgical or chemo or radiation or immunotherapy, we use the CA19-9 as a surveillance tool to see if there's good response or not.
Right.
Or if there's recurrence of the pancreatic cancer. So it has never been meant to be used as a screening tool.
I think the thing to point out, as you may have said before, is that not all tumors secrete CA19. Not all pancreatic tumors secrete CA19-19. So you'll miss CA19-9. So you'll miss the ones.
And also, CA19-9 is produced by other types of diseases.
Right.
So what happens is that if you have a mildly elevated CA19-9, this patient now has to be thoroughly investigated,
Right.
which might mean invasive tests such as endoscopies, CT scans, MRIs, and maybe PET scans.
Yeah, and that's painful.
Which is painful and expensive.
Yeah.